Hello again, AP students. This is Mrs. Politsky, and I have notes for Chapter 13, AP Psychology. How do psychologists treat psychological disorders? So let's begin. Psychologists employ two main forms of treatment. Insight therapies, which focused on developing of the problem, and behavioral therapies, which focuses on the changing of the behavior through conditioning. For this section, we're going to focus primarily on the insight therapies. So, insight therapies, these are psychotherapies in which the therapist helps the patient or client understand or gain insight into their problem, helping people change on the inside. An example of this would be like talk therapies. These are psychotherapies that focus on communicating and verbalizing emotions and motives to understand the problem. Insight therapies come in dozens of different brands, but all take a clinical perspective, using various techniques for revealing and changing the patient's disturbed mental processes through discussions and interpretations. Examples would be the Freudian psychoanalysis. This assumes that the problem lies hidden deep in the unconsciousness. Carl Rogers' non-directive therapies, such as group therapy, perhaps minimizing the importance of the unconsciousness, but looking for problems in the ways people think and interact with each other. Freudian psychoanalysis. The Freudian view of psychological problems arises from tensions created in the unconscious mind by forbidden impulses and threatening memories. Psychoanalysis is a form of the psychodynamic theory developed by Sigmund Freud. The goal of psychoanalysis is to release conflicts and memories from the unconsciousness. Free association. This is a technique that psychoanalysts use. The patient would relax and talk about whatever comes into their mind. The psychoanalyst gradually develops a clinical picture of the problem and proceeds to help the patient understand the unconscious causes of their symptoms. Analysis of transference, or sometimes known as just transference. This is a Freudian technique of analyzing, interpreting the patient's, I guess you could say, relationship. And typically this mirrors unresolved conflicts in the patient's past. A patient will recover when they are finally released from the repressed or repressive mental constraints established in the relationship with their parents during early childhood. The humanistic theories. These are treatment techniques based on the assumption that people have a tendency for positive growth and self-actualization, which may be blocked by an unhealthy environment that can include negative self-evaluation and criticism from others. They believe that people are generally motivated by healthy needs for growth and psychological well-being. Studying the whole person is kind of the goal of the humanistic therapist. College students seek therapy for low self-esteem or feelings of alienation, failure to achieve all feel that they should, or failure to achieve all they should, difficult relationships, and general dissatisfaction in their lives. These problems are commonly called existential crises. Client-centered therapy. These are kind of the therapies that, if you remember back to Carl Rogers, emphasizing an individual's tendency for healthy psychological growth through self-actualization. The goal is to help people reach their potential or their full potential. But for healthy development, it can be hindered by conflict between one's desire for positive self-image and criticism by the self and others. The task is to create a nurturing environment in which the client can work through their conflicts to achieve self-enhancement and self-actualization. The reflection of feeling. This is a technique that Rogers used by paraphrasing the client's words, and in a way, this is kind of a way that we can communicate with others to show them that we are paying attention. But the technique basically would help perhaps maybe the client understand her emotion. The therapist would assume that people have basically Healthy motives. These motives, however, can be stifled or distorted by social pressures and low self-esteem. And the therapist's task is mainly to remove the barriers that limit the expression of the natural positive tendencies that help the client clarify and accept their feelings. It's all about genuineness and empathy and unconditional positive regard, a non-judgmental acceptance, and respect for the client. The therapy is most likely to be successful when the therapist provides these Rorgian qualities of empathy, positive regard, and genuineness and feedback. Cognitive therapies. Cognitive therapy emphasizes rational thinking as opposed to subjective emotions or motivation or repressed conflicts as the key to mental disorders. Aaron Beck once was a psychoanalytic therapist, but he broke ranks when he began noticing that the dreams and free associations of his depressed patients were filled with negative thoughts. Aaron Beck began to believe that depression occurs because of these negative self-conversations or self-talks that we have. And as a cognitive therapist, he helped individuals confront their destructive thoughts that supported this depression. Studies have shown that Beck's approach can be at least as effective as medication in treatment for depression. Group therapies. This is any kind of form of psychotherapy done with more than one patient or client at a time. Group therapy is often done from a humanistic perspective. It focuses on the problems of social behavior and relationships. It can be done with couples, families, groups of people, and they meet once a week or over the internet. Self-help support groups. These are groups such as Alcoholics Anonymous that provide social support and an opportunity for sharing ideas about dealing with emotional problems or common problems. Such groups are typically organized and run by lay people or lay persons rather than professional therapists. More than 500,000 people or groups are attended by 15 million Americans every week. This is for management of life after divorce or the death of a child, coping with the physical or mental disorders such as diabetes, heart disease, depression, dealing with addictions like alcohol, gambling, overeating, the handling of stress felt by relatives or friends of those dealing with addictions. Many are free, so they're relatively inexpensive to participate in. Such groups give people a chance to meet under non-threatening conditions, to exchange ideas with others that have similar problems and are surviving and sometimes thriving. Group therapy makes valuable contributions to the treatment of the terminally ill patient. The goals of such therapy are to help the patient and their families live their lives as fully as possible and to cope realistically with the impending death and to adjust to terminal illness. Couples and family therapy. Couples learn how to clarify their communication problems and to improve the quality of their interactions, identifying the verbal and nonverbal styles they use to dominate, control, or confuse each other. Couples therapy typically focuses on the personalities involved, but on the process of the relationship, particularly their patterns of conflict and communication. Family therapy, the client is the entire nuclear family, and each family member is treated as a member of a system of relationships. Family therapists can only reduce tension within a family, but it can also improve the functioning of individual members by helping them recognize the roles in the group. Virginia Satir was noted that the therapist has a role to play during this kind of therapy. They are an interpreter, a clarifier of interactions, an advisor, a mediator, a referee. Both focus on the situational rather than the dispositional aspects of a problem. The therapist helps the family members look at how they interact rather than the individual's motives or intentions. Thank you very much.